Before I start, I wanted to make this clear that this video is intended for Xsculpt patients only. The techniques that we use during our surgery is specific to our patients who during their consultation, we talk about diet and exercise. And our techniques are customized based on those recommendations. What we do in Xsculpt during our procedures may not apply to other surgeons and their patients. They may have a different technique. They may have different advice. It might not be right for you. Furthermore, in the preoperative and postoperative period, I follow my patients very closely and give them advice as we go. So it's always changing. So again, I want to stress that this video is for Xsculpt patients only. If you're not from Xsculpt, I do hope you get some information that you feel is important. But if you've had surgery, then again, I would check with your surgeon and see if he or she feels that whatever exercise or diet plan you choose afterwards fits with what their surgical plan is. Also, although I am a surgeon, I do have specialty training in exercise physiology and nutrition, and a lot of the supplements that I recommend and the diets and the specific exercise that I talk about. There is a reason for that. We work with many athletes and personal trainers and other exercise physiologists and everything, and so a lot of the information that we get, that you'll hear in this video, as well as during the personal consultation in our postoperative period, all that advice is it's not just bro science. It's actually based on evidence-based medicine and what the latest things are, the latest trends, and what the research has supported out there. Okay. Again, I hope my patients, when you watch this, I hope you get a lot of great information, and I really encourage that if you do a good diet and exercise programs to really make your the money and the time you invested in the surgery really enhance it. And then if you're not a patient, I hope you find the video entertaining. Okay, great. So let's get started. Hi, this is Marc Adajar from Xsculpt, and today's video is about diet and exercise before and after your surgery. I get this question a lot during our consultations about, should you go on a diet before surgery, or you lose as much weight as possible, or after surgery, should I go on a diet after surgery? What kind of exercise to do before and after surgery? So I want to make this video so that everyone can be well informed and answer a lot of the questions regarding this. So before your surgery, if you commit to having surgery with us, before your surgery, I don't like you going on a cut or any type of severe diet or any real calorie restricted diet with the intention of dropping a lot of weight so that it makes the surgery easier or anything like that. That's not a good idea. The reason why is because you need calories to heal after the surgery, and your recovery time will be really prolonged afterwards. So you don't want to go on a cut or a calorie restricted diet before the surgery. For me, it'd be best if you go on a maintenance type of diet, or a regular diet, or even a bulk. That would be even great. If you go on a bulk type diet while you're exercising to really build up your muscular mass, it will really make your results afterwards pop or enhance. So it's always good to either maintain or bulk, but not a cut. Another reason why it's not a good idea to do a cut before surgery is because your fat cells will get really small, and even though we do get as much as we can, if you gain weight back after surgery, or you go back and you're on your regular diet and you gain the weight, conceptually you could develop fat pockets or areas of fat that weren't there before, that we didn't see, that we could have taken care of. So another reason why not to do any type of severe cut or calorie restricted diet. Now, exercise before the surgery. If you're undergoing the gynecomastia surgery or ChestSculpt surgery, basically it's building up your upper body with a lot of chest work, a lot of back work, and a lot of shoulder work, because it will all come together. Now for your chest, just straight bench, incline chest pressing, dips are great, is a great mass building exercise. Shoulders, a lot of overhead pressing or lateral raises. Back, it's the rows and the lateral pull downs or pull ups. All these exercises are great to build up the mass before surgery, so that your results afterwards will look great. For your chest, pectoral flies are great. Just straight up flat bench. I like dips, again, with the intention of bulking up or building muscle mass overall. Now, after surgery, it's a little bit different. So your diet after surgery should be immediately in the immediate postoperative period, for up to 3 months. You should be maintaining your diet, because again, you need calories to heal. And if you restrict your diet after the surgery, your healing will take a lot longer. Okay. So just maintain. If you want to bulk, you can, but maintenance would be best. And then at 3 months, that's when you start your cut. If you want to really make the results look like really great, you start your cut around 3 months. And not only will that look, not only will your chest look great, but your overall physique, your overall body. Same thing with the abdomen. If you do a lipo 360 or a total sculpt, then you want to maintain in the early postoperative period, and then 3 months start your cut. If you do your lipo 360, I wouldn't recommend doing a bulk, because even though we did physically remove the fat cells, your face could still get big, your butt could get big. But so I think it would be, if you want to enhance your look, then go on a maintenance for 3 months and then go for a cut at the 3 month mark to however long you want. Okay. Now, exercise afterwards, for your chest, no chest back or cardio for 2 weeks, because that's going to increase your swelling. Same thing with your abdomen, nothing for 3 weeks, sometimes 4 weeks, depending upon how much swelling you have. Stretching is great, your regular activity, walking around, passive stuff, but nothing too intensive for the first 2 weeks, because we don't want the swelling to increase. Now, after 2 weeks, then that's when you want to start doing for your chest. You want to do chest exercises, back exercises, to make your results pop. What's going to happen when you do those exercises in the postoperative period? It's going to help with skin tightening, number one, and number two, the scar tissue that you unfortunately will inevitably develop after any type of surgery. It's going to form to your specific anatomy while you're doing your exercise. I always explain that scar tissue is like pizza dough. It always starts out like pizza dough, where it's a big ball, but as you knead the pizza dough with your hands, it starts to flatten out. Your body's scar tissue is the same way. It'll all build up and get really, you'll feel it really hard, but then as you're doing your exercises, the scar tissue is going to mold to your specific anatomy. So I like incline chest pressing and pectoral flies to really bring everything up, and towards the middle, because a lot of that surgery is done in the lower chest. Lat pull downs or pull ups for the work we do behind the lateral portion of your pec muscle here, and rows to pull the skin backwards and towards your back. With a relatively high intensity, if you're used to lifting heavy, that's great. I would go heavier so you can build up the mass. But it's more, a lot of it is just the range of motion. Okay, for the abdomen, for the first, again, you could start doing your exercise around 2 weeks. Depending upon how sore you are, 4 weeks would probably be better. But when you start, you can start out slowly. With all the exercises, start real slow. Don't, I usually say maybe 25% of your 1 rep max, and then move your way up from there. You can move up quickly, but it's safe to start at a much lower intensity and then work your way up. Now, if you do liposuction in the abdomen, start out with planks, see how planks feel, and then if you can do planks and no problem, then go straight to your abdominal exercises. And then when you do your abdominal exercise, you want to hit the 4 areas of your abdomen. So you want to do upper abdomen, lower abdomen, and then obliques. For your upper abdomen, just regular, crunches where you bring your head up. That's great for your upper abdomen. For the lower abdomen, I like either the captain's chair or hanging knee raises or leg raises for the lower abdomen. And that's really important. Often the lower abdomen is underdeveloped in most men. So to do that lower abdomen, to give you that cut, what we do is we really liposuction all the fat right along that lower abdomen, so you can see that line that comes in right down there. So really work on that, really work to build up that lower abdomen by again, knee lifts or leg lifts. And then the obliques, the obliques to help because we really thin it out. By doing the obliques, it will make your six-pack pop. I'm not a big fan of side bends. But those do work also, but like Russian twist would probably be my choice. Also for the back exercises also will help your get you that tapered look in the back. If you do back extensions, you can do that to build up the paraspinal muscles to make that look really good. Your pull-ups and your lat pull-downs will help bring in a little bit more of that V, because we do liposuction of that area. Also, for the lower back is squats, because your back merges into your upper buttock. By doing squats, it'll give you a little bit of that raise. We do liposuction to enhance the junction of the area, to give you a little bit of a butt raise. But if you build up that musculature, it'll look really nice and it'll come all together. So basically, that's a quick video on what I recommend for diet and exercise before and after the surgery. If you have any questions, my patients, you have my cell phone. You can text me anytime. You can leave a comment below. Unfortunately, we don't return those we try to return those if we can, but you can text me anytime and feel free to email me. All right. So I hope this answered a lot of questions, and I'll see you guys soon. Bye.